Hello, welcome to Chairside Live. I'm Megan Strong.
And I'm Will Schmidt, Registered Dental Assistant here at Glidewell Dental.
And in today's episode, we're kicking off Dr. Muresan's three-part case, and it's a BruxZir Esthetic veneer case, right? And we know that not all veneer cases have crowding and malalignment. You know what, Will? In this episode, it's quite the opposite. We've got some large interproximal spaces, we've got excessive gingiva. So what's the plan? What's happening in this first episode?
Well, I tell you what, this patient also had a series of facial piercings. And I wonder how many times you have to bite on a tongue ring before you decide it's probably a bad idea.
Right, maybe once.
Yeah, the world may never know.
Right.
But anyway, this patient had fairly good oral health, and the teeth were pretty straight to begin with. So what we're going to see today is Dr. Muresan's diagnosis and the science behind these findings.
I love it. Let's get right into it. Dr. Muresan?
Hello everyone, thank you for joining me. In today's episode, I will show you how to incorporate laser procedures with your cases and elevate the aesthetics using the newest highly translucent monolithic zirconia, BruxZir Esthetic. We have the pleasure today to meet Ashley, a young woman whose main concern was a broken tooth. She also reported that anytime she looks in the mirror, she sees large spaces between teeth and she thinks her teeth are small with a lot of gum showing. She reported breaking her central incisal while she bit on her pierced tongue. She was interested to fix the damage, minimize the spaces, and her gummy display. This clinical scenario is easy to treat with no prep veneers, with great aesthetic results for the patient. Looking at her close-up smile, we can note she has excessive gingival tissue over her maxillary anteriors, making these teeth seem out of proportion and asymmetric with a lot of gingival excess. With the exception of number 10, where her facial piercing was rubbing against the gingival tissue above number 10, making this tooth appear longer than its contralateral 7. A gingival display of more than 2 millimeters is considered to be unattractive. Looking at these pictures, we can see that her gingival display was about 6 to 7 millimeters. The periodontal exam revealed gingival excess, very little plaque, and no bleeding on probing. Next, I look at the incisal edge position relative to the face. Using a photo with lips at rest, I evaluate the incisal edges in regards to the lip position at rest and relative to the face. She has a reveal of 3 to 4 millimeters, which is normal for her age, and she has no tooth wear. My diagnosis after reviewing all the clinical findings was altered passive eruption. This was the cause of anatomical crown being submerged under the gum tissue. To better understand the etiology of gingival excess, let's review the pattern of eruption. Active eruption is the movement of the tooth out of the alveolar bone into functional position on the occlusal or incisal plane. Passive eruption is the exposure of the teeth due to apical migration of the gingival tissue. Altered passive eruption is the failure of the gingival tissue to migrate apically to expose the entire clinical crown and obtain a normal position of the base of the sulcus relative to the CEJ. Once the diagnosis is made, the next step is to look at best way to treat it. Please join me in the next episode where I will show you the steps I follow to alter the pink aesthetics.
Well, thank you for that, Dr. Muresan, and be sure to tune in for the remaining installments of this exciting case.
But part one's all wrapped up for today. So on behalf of everyone here at Glidewell Dental, thank you so much for watching.
And we will meet you right back here next time.